CPR, cardiopulmonary resuscitation, is an important skill practiced by thousands of healthcare professionals across the country, hundreds of hours of training, done in labs just like the one you see us in here today. Hi, I'm Bob Page, Director of Education for Edutainment. I'm a paramedic and a critical care educator. And today we're going to talk about the importance of CPR, namely our ability to do CPR continuously and accurately and properly. In classrooms such as this one, we practice these skills till we can achieve perfection. We can do them correctly. Numerous studies have shown that survival can depend upon how well CPR is done. Push hard, push fast is what we're taught, and it's good. But does that skill transfer from the classroom to the streets, the real streets? We need help. We need real CPR help. With real CPR help, you get real-time feedback on the monitor screen. For example, our provider here is not pressing hard enough, as indicated by D on the monitor screen. Push harder. However, as the rescuer pushes harder and gets the proper depth of compression, you will see the D disappear and the perfusion line go all the way to the end. Also, please notice at the bottom, you have your bars, pink bars that are between the dotted lines. That indicates correct depth of compressions and also correct rate. Notice these compressions are too slow, as evidenced by the R on the screen and the audible alarm. Push faster. As our rescuer increases his rate and gets to the adequate rate of compressions, the real CPR help once again shows you the perfusion bar moving to the edge. If you'll notice down at the bottom at our purple lines, they're in between the dotted lines, indicating proper rate and proper depth of compressions. In a cardiac arrest situation, it's important to do proper depth and compressions of CPR. As we see here, we're doing good CPR. However, every 2 minutes, you're supposed to stop and check the rhythm before you provide your next intervention. So stopping CPR does cause a drop in perfusion. If you're doing this every 2 minutes, you can see we're going to have some times in there where we're losing perfusion. And it's very important to maintain continuous CPR. See-through CPR with this device actually can help us in this endeavor. As we continue compressions, the machine actually senses the underlying rhythm and filters out the CPR artifact, as you can see here on the screen. The CPR artifact at the top and below the underlying rhythm. This allows you to make better decisions about drug therapy and also checking pulses at appropriate times. See-through